Okay, as it's a public meeting, we'll make a start. I'm sure a couple of members who aren't with us at the moment will join us as soon as they're able. So welcome everybody to the board and welcome anybody who is viewing this on YouTube. This is our public CCG board meeting that we have once a month. We have been doing it virtually now for a couple of months, but any feedback through the website would be greatly appreciated from any members of the public who are watching. I will do a quick round of introductions, so I'll just do it from a list of people I can see. So I'm Richard Cullen, I'm a GP and I'm chair of Rotherham Clinical Commissioning Group. John, you're on mute. You're on mute, John. Still on mute. Shall we move on? He seems to have frozen. Ian?
Good afternoon. I'm Ian Atkinson, Deputy Chief Officer, Rotherham CCG. Good afternoon.
Janet?
Janet Weekly, I'm the lay member for the Primary Care Committee.
Jason?
Jason Page, GP and Vice Chair of the SCE.
Simon?
Hi, I'm Simon McEwen, GP and Vice Chair of the GP Members Committee.
Chris?
Chris Edwards, Chief Officer.
David?
David Clitheroe, GP.
Sue?
Good afternoon, I'm Sue Cassin, I'm the Chief Nurse at the CCG.
Wendy?
Lindsay Hill, minute taker for the CCG.
Oh. Okay, Wendy?
Hello, I'm Wendy Allett, Chief Finance Officer at the CCG.
Jeff?
Hi, Jeff Avery, GP and Chair of the Members Committee.
Debbie?
Good afternoon, everybody. Debbie Twell, lay member for Patient and Public Engagement.
Ryan?
Ryan DeCosta, Secondary Care Representative.
Sorry, John, do you want to have another go at unmuting yourself?
Sorry about that. Yeah, hello, I'm John Barber. I'm lay member for governance. Okay, so we are quorate. We have apologies from Ruth Nutt Brown and Dr. Lee Hunt, who's our public health doctor. Any declarations of interest? Okay. Are there any patient or public questions?
Not that I'm aware of, no.
Okay. And as a point to anyone watching, we happily receive those questions either written or you can post videos to us, which we could then show on this virtual meeting if that's something people prefer. Okay, so we move then on to the minutes of the last meeting from August. So we'll go through them for accuracy and any items arising that aren't on the action log. Page 1. 2. 3. 4. 5. 6. 7. 8. 9. 10. 11. 12. 13. 14. 15. And 16. Okay, thank you then, Lindsay. We'll take that as an accurate record.
Thank you.
Moving on to the action log. They are all green. And I think they're all on the agenda, apart from, have we provided a senior officer to the...
Yeah, Chair, our Chief Nurse will be joining that session.
Okay.
And
have
Dr. Page.
Yeah.
And Dr. Brilliant, thank you. So
Excellent.
we can turn that one green, Chair.
Yeah, that's great. Okay. moving on then. Chris, Chief Officer report.
Thank you, Chair. Hello, everybody. So just go through, just normally, as I normally do, the documents there for everyone to view, but I'll just go through and just summarise, and if people just want to ask questions as I go through, that'll be appreciated. So the first item in the Chief Officer's report is the NHS letter, the phase 3. So when we refer to phase 3, what we mean is the initial outbreak was the phase 1, phase 2 was the lockdown and recovery period, and then phase 3 is the sort of getting back to normal, catching up between now and winter period of the COVID pandemic response. So the document just highlights there's 3 key objectives in the phase 3 period. So it's accelerating the return to near normal COVID levels of health services, preparation for winter demand alongside COVID and being flexible enough to deal with COVID as well as winter, and also making sure that we encapsulate any learning from the first COVID peak and lock in any beneficial changes, and particularly focus on the learning around health inequalities and prevention. So we'll be expected over the next couple of weeks to come up with a full plan for the Rotherham Place, to link it into the South Yorkshire and Bassett Law system, and be ready with a plan for phase 3 in winter. Any questions? Everyone okay with that? Obviously, we'll bring the plan through this committee in due course as it goes through normal process. So CCG governance. This is so what we did in March. We changed our governance arrangements for the pandemic period as the country went to a level 4. In recognition that nationally we've now gone from a 4 down to a level 3, we now will move back into normal governance arrangements. So I'm just alerting governing body and just documenting that that's what we're doing in public. Obviously, we'll keep a close eye on the national response level. If we do go back to a level 4, I would expect us to have a discussion at this committee about whether we reviewed our governance arrangements as appropriate. So John, as chair of the audit committee, I would liaise with you to do that, if that's okay.
Yes, Chris, I'm very supportive of that proposal. Yeah.
Okay, we do need to record in the meeting, Chair, that the governing body is comfortable with this approach. So could we record that the governing body support this approach?
Okay.
Yes.
Okay with that. Okay, thank you, everybody. Okay, so next is prescribing incentive scheme, and it's just going through and just to show we've reviewed the payments and we're assured the principles are appropriate and it's stand up for scrutiny for the 1920 programme. So again, just informing governing body members that that's how we'll be approaching the 1920 prescribing incentive scheme, just for transparency. And finally, the national flu letter. So on our worry list at the moment is obviously getting the NHS back to normal as quickly as possible, but flu vaccination is going to be absolutely essential this year as we try to manage normal winter pressures with COVID. So there's an extended qualification for people to receive the flu vaccination. So we've got household contacts for shielded patients. We've got children of year age in secondary schools. That's year 7, that's first year at secondary school. And all health and social care employed through direct payments, personal budgets, and of course the over 50s. And also we're hoping to get 100% of all health and social care staff as well this year. So we're working with our community and primary providers trying to come up with a plan to do this significant piece of work. It's significant in terms of the scale, but it's also significant because of it's a very difficult it's very difficult logistically in the world of PPE and COVID to give face-to-face contacts and face-to-face vaccinations. So thanks for everybody for their work to date on this. I would expect us to bring this back to governing body as part of our winter planning, Chair, as part of our flu response as well. So we'll keep governing body informed on that, but just there's a copy of the letter we've received.
Okay, Jeff's got his hand up.
Sorry.
I didn't know whether Ian or Chris, just the fact about health workers 100%, do we have figures from previous years as to what that's achieved? I know this year's special and different as about how many people might pick that up, but do we have figures from past years about what we've achieved in before?
I couldn't give you a specific quote, Jeff, but what I think it varies from organisation to organisation, but I think it's around the sort of 2/3 mark in terms of vaccinations. Is tends to be around the norm, but I can check that and get some more detail. I'll do that separately if that's okay.
Thanks.
Okay, and the last just thing is a communications update. Again, with the wider NHS about switching the focus to service recovery, mental health communications, and the further development of our digital Rotherhive service, which is something which we're trying to promote actively, because then it's something that's very accessible to our patients in this COVID world. And also winter communications, trying to support local residents across the health and care system, because this winter accessing service is going to be quite a bit different for the Rotherham population. And we need to make sure that the key message is talk before you walk. So non-face-to-face contacts wherever possible. But obviously we need to help work with our population to try and make sure that everyone gets the best possible service. So that's me, Chair. I'll take any questions.
Any questions on that for Chris?
Chris, could I just have one further bit of information on Rotherhive? I know governing body received the Rotherhive overview, which is our website support with mental health. We've had latest figures that came through yesterday, 12,000 hits on that website now, and they're individual visitors, which is about 6.3% of the Rotherham population. So that's increasing all the time, month on month, because it's been going 3 months now. But again, for members of the public to kind of review and access that, it's a really good resource of information for members of our Rotherham population.
Okay, Jeff's.
Yeah, and I think I was just going to add to that, Ian, about saying that actually I think the Rotherhive is a positive sort of useful resource that is easy to work around and has got lots of information as far as that. So I think it's a positive thing that's been put into place.
Any other questions for Chris? Okay. Wendy, then, the finance and contracting report.
Thanks, Chair. This month's report is the position at the end of July 2020. July is a month, it's the 4th month of the 4-month temporary financial regime that was put in place as the part of the emergency response. So short reminder that amongst other things, that meant that the CCG's previously notified allocation was replaced with a nationally calculated allocation that was broadly based on expenditure at month 11 in the previous financial year. And so the operating cost statement that you see at section 5 provides our view of actual performance against that nationally assessed allocation. In summary, the report provides assurance that cash is being managed and that payments are being processed in line with the requirements of the temporary financial regime. Performance-wise, we're reporting a year-to-date net overspend of 1.95 million, of which 1.65 million is due to COVID-related expenditure. And in line with guidance, the CCG would expect to receive additional allocation to cover those reasonable variances and bring the organisation back into a break-even position. And as at this morning, I can confirm that we've received that allocation. So effectively, we're at break-even at month 4 again. We've included the usual narrative in the report to describe the most significant variances line by line in the OCS, the operating cost statement. But can I just draw your attention in particular to the work that's been done behind the scenes on prescribing in CHC, the objective which is aimed at providing greater or being able to provide greater financial assurance on the position on those 2 areas in particular in the latter part of the year. Looking ahead, for just the financial arrangements in place that have been in place for months 1 to 4 are now confirmed that they will largely roll forward into months 5 and 6. And so to that extent, the CCG will be given an allocation for months 5 and 6 that is in line with the month 1 to 4. But the intention beyond that is nationally to move to a revised financial framework for the latter part of the year. That will seek to be based around fixed allocations and is likely to include features, including some allocations coming in at system level rather than down to CCG level. The precise arrangements are still to be clarified and are understood to be the subject of ongoing discussions with Treasury. So I shall just keep you updated on that in future months. So if it's okay with you, Chair, I'll pause there. Happy to open up to questions on month 4.
Okay, any questions on that from anybody? No. Okay, thank you then, Wendy.
Thank you.
Ian, I think you're next. Remarkably, you've only got one paper on this month.
Thank you, Chair. Okay, so this is the latest view in terms of performance for the system. So just to remind colleagues, we report by exception on this document. Because of some of the reporting during COVID, there's a bit of a historic view in terms of some of the trend data on here, but I'll talk you through some of the key parts of that. So we talk a lot in governing body around A&E performance. Just to remind colleagues that Rotherham for a number of months now has been part of a national trial, and that continues. So he's not currently reporting 95% position on performance. However, I can report that the performance has been positive against the national pilot performance over recent weeks and months. In terms of numbers coming through the A&E department, I know this has been a point of discussion in previous governing bodies. We are now starting to see numbers increase back towards where we'd expect them to be in terms of presentation to the A&E department, but not to the level that to the levels that we have seen in previous years. So just reflecting, when we were right in the middle of the COVID pandemic, we've got really low attendances at A&E, and they've gradually started to increase, but not quite to the level that we'd had in previous years. So for context, numbers between 230 and 260 a day. Our contracted position, particularly with TRFT, is around 300 a day at any one point, and in real busy winter days at 330. So you can see there that numbers have come back up, but just slightly below where we'd expect them to be at this point. In terms of the performance position on other metrics, it is quite challenging. Coming out of the other side of COVID, we are now starting to see impact on performance, both at a CCG level and at a TRFT level. In terms of our cancer performance, you can see there we're flagging some challenges around cancer. It was one that was pre-COVID quite a challenging target to hit in terms of the national standard for treatment within 62 days, which is the 85% target. But again, we've not met that in June or May, down in the 60s. So that is a challenge for us. It's a challenge for other parts of the South Yorkshire and at a national level, really. One, in terms of getting patients through systems, but also giving patients the confidence to access healthcare. So we continue to be in dialogue with that, and I'm sure Jason will mention something around that shortly. One of our positive areas of performance for a number of years now is around our planned care aspect. So this is where patients go through for routine surgery and outpatient activity, as opposed to urgent care. And you'll all know around the 18-week wait and 52-week wait targets that we prided ourselves on in Rotherham in terms of delivering consistently over a number of years. What you can see on the performance report now is the real impact of the COVID pandemic in terms of planned care, when in effect, while the hospitals, not just TRFT, but other hospitals across the patch and nationally paused a lot of their elective activity to allow for the COVID response to take place within hospitals, that's impacted on our waiting list position across a range of specialties. And you can see on the chart, which is quite clear there, how we've moved from a performing system to one on the 18-week target that performed at 57% in June and 50% on the provisional in July, against the target that was 92% of people accessing treatment within 18 weeks. With those longer waiters, unfortunately, we now then see increasing numbers of individuals across the system starting to wait more than a year, 52 weeks for treatment. We're flagging 78 52-week waiters in this report. I'll be open with the governing body on this, is that it will probably get more challenging before it gets better in that case. mainly on the basis that obviously we're trying to reset and restart services, but in the basis of also treating clinical priority as you'd expect, and that's following national guidance. So the area of planned care and recovery now of our planned care targets is really key, and we'll be bringing that through governing body accordingly. Linked to that is our diagnostic weights. Some real challenges there again with our diagnostic capacity. So again, with our ability to flow patients and also the restrictions on our ability to do diagnostic provision. Again, we were in the top 20% of performing systems in the country pre-COVID. Now, like many areas of the country and South Yorkshire, our targets against the 6-week wait for diagnostics is really challenged, and you can see the detail there in the report. Positively, our IAPT access and IAPT provision is holding firm, but we are now starting to see increased referrals through mental health services as expected. We are trying to bolster that, obviously, with the introduction of a further partner to work with us on IAPT services over the coming weeks and months, with the expectation of increased demand through our mental health services. So I think that just about summarises where we are in terms of performance, which is a challenge position. But I'll take any feedback and comment. I don't know if Jason's got anything further he'd like to share on the cancer position.
Jason?
Yeah, just really to say that it's challenged everywhere. Obviously, the diagnostics links into the into the position. There's the challenge of getting patients around. Endoscopy has been particularly challenging as well. I think the trust are doing everything they can to try and get things going, but it's sometimes 2 steps forward and 1 step back, trying to get things up and running. But you know that they're doing what they can. They're putting a real effort in, and I think at the moment that's the best thing we can ask. And performance is gradually improving, is what I would say.
Okay, any other questions for Ian? Okay. Thank you then, Ian. Chris, organisational development.
Okay, so in terms of our OD plan as an organisation, it's been quite a tricky review this time. So the operational executive review it on a quarterly basis. It's obviously things have changed a lot since this document was written and when we've come to review it. So I think we've reviewed it as best we can, but I think in terms of the governing body, I think I need to undertake an action to look at reviewing the document in its entirety. And I think we probably need to look at our approach to risk as well, and our governing body, the GBAF as we call it, the governing body assurance framework. So it was due here as a standard report, the OD plan. It's not part of our normal review process. I don't know if people have any strong views on it, but I would suggest that over the next few months, I take the action to develop a post-COVID organisational development refresh. I'd be interested to get people feedback, see if people would be happy with that approach.
I can see 1 thumbs up, 2 thumbs up.
Okay, no, but I mean that's really helpful. It's going to be quite challenging to do this piece of work. So I'll probably come back with dates about how I can complete that appropriately. So I'll need to go away and do some review and see if I can find some best practice from elsewhere and see if I can find some ways of working. And I guess as a governing body, we'll need to have a development session to understand, because the OD plan will need to encompass everyone's views and perspectives. So it'll be more of a process rather than just a document that's received. So I'll construct a process to get to that OD plan.
Yes, it'll be interesting to see a remote working organisational development plan. So it'll be a challenge for you, Chris.
Yeah, I like a challenge. Obviously, I'll involve everyone in trying to meet that challenge. It'll be a team effort. But I think whatever we do will have to be very agile and flexible as well. So it'll be an interesting approach, because it'll need to be an evolving document as we go forward and better understand the situation we're working in.
Okay. Any other comments, questions? All right then. Okay. Sue.
Thank you, Chair. So starting off with the beginning of the report, I'll just draw your attention to some of the things that I think are key and take questions if that's okay. So infection prevention and control, the trajectories that NHS England would normally set for us for healthcare associated infections haven't been set as yet this year. We are expecting those to be set. So we're sort of fighting against a number that we don't know whether it exists or not. However, that hasn't stopped the work to investigate all cases and extract learning, and all that work continues, all that remains in place and continues as per. Some of the comparative data is there on page 2 with previous years, and the E. coli data. Again, the trajectories haven't been set for us, but we're still undertaking work to reduce numbers, investigate, share learning, learn from others. We're very much involved in both local work and regional work in terms of healthcare associated infections. Our infection prevention and control nurse has been involved in quite a lot of work, as you can imagine, around COVID as well, supplying advice and guidance, communicating the national guidance at a local level, and also giving advice around some of the services that we set up, such as the hub where we have seen GP practice patients, and in response to a directive from NHS England, we undertook an extensive programme of support to care homes. This was developed and delivered by a multi-agency team that included the CCG, our foundation, trust, mental health provider and the local authority, and it was to comply with the requirements of the request from NHS England to be undertaken during quite a short period of time. We've continued to provide that input on responding to requests from care homes, and also where some care homes have preferred face-to-face sessions, some have preferred not to have non-essential visitors to care homes. So we've responded as a multi-agency group to that request. And those of you that have been to Oak House recently will have seen the advice signage together with sanitising hand gel and wipes that are available. So work around a safe return to Oak House for those people that are needing to work from the office continues. Further down on that page around serious incidents, the Serious Incident Committee will undertake some more frequent meetings for a period of time to progress a number of reports that need to be progressed through the system. And on the safeguarding information, going through page 5, the next few pages, there's further information. Safeguarding information and update awareness weeks have been delayed, and these are now planned in November, and you can see some of the sessions that will be available and the contact details are there within the report. Some of the information that's been communicated out to general practice, a reminder of the BLTC event that will now take place in May to cover off primary care's safeguarding training, a lifelong legacy. We keep putting it in as a reminder so that planning's underway, so that that it's there. It continues to remind people that this will take place next year. Sorry. Updates from last month up to the end of August around work that's undertaken there around safeguarding. Some of the ICON work, which is a national initiative that's been progressed and taken forward locally with simple messages communicated around infant crying. So you can see there the icon represents infant crying, comforting, it's okay, and never shake a baby. It's all around those keeping the messages simple and communicating them as far as possible. The care homes, we haven't had anything new to report from CQC reports around care homes. And down onto the multi-agency safeguarding hub update, that work has continued with a renewed emphasis on hidden harm and hidden in plain sight, and people who may, because of lockdown, where we may not have had communication. So multi-agency response to that. Continuing healthcare, we've already mentioned quite a bit about continuing healthcare, particularly adult continuing healthcare. There is a bit of a refresh there of the direction from NHS England around the changes that came in March that went through until the end of August. And just to reiterate that the restart of continuing healthcare was the 1st of September. So from the 1st of September, all of those patients who were discharged from hospital using the rapid discharge and framework for funding now have to be assessed in terms of their needs, to ensure we're meeting their needs and their eligibility for particular pots of funding through continuing healthcare, both for the CCG and for the local authority. So that work, planning around that work is underway. Action plans are in place. That work will start shortly. And together with that, at the same time, from the 1st of September, a new pathway was put into place to ensure a 6-week discharge pathway, so that patients, people who are discharged from hospital who require packages of care, that this is definitely in place within the 6-week pathway. Though that pathway is under development at the moment. It's a multi-agency response to that, working very closely with the Foundation Trust and with the local authority. Going through onto page 14 on CQC inspections, and just a very brief update around the July inspection of the children's pathway undertaken by the CQC. In addition to the reporting to the CQC and the reporting through the CCG contract quality process, the Trust's Chief Executive and Chief Nurse met with myself and Chris Edwards and the Chief Executive and Director of Children's Services from the local authority to discuss arrangements for ensuring progress against the action plan, to allow us to raise questions and gain additional assurance of progress along that action plan. That's also been reported through the Rotherham Safeguarding Children Partnership on a regular basis, both to the exec meetings and the wider partnership meeting. And the Trust will, the Trust Chief Nurse will provide a detailed presentation at the next meeting of the wider partnership there. Assurance reports for different aspects of some of our commission services in terms of A&E Council, we've already talked quite a lot about, and looking down through looked after children there, and some of the work we need to catch up with also in that area in undertaking the initial health assessments within the statutory 20 working day time frame. Some of those have fallen off. A lot of work to catch up on all of that. And that, I think, was all I was going to mention. I'm happy to take questions on any part of that.
Okay, thank you, Sue. Have we got any questions for Sue on that paper?
Oh, can I just mention it with the serious incidents? The appendix at the end of this report is the serious incident committee annual report that has been to the committee, and it's been to Aqua.
Okay. John, there was nothing on reviewing that paper in Aqua?
Well, we reviewed the SI annual report yesterday, actually, at our meeting, and in the context of a very good annual report that we thought was very comprehensive, we had two areas of concern, I think, in terms of some future work for the SI committee. One was the the number of outstanding SIs in terms of timeliness of reports, timeliness of signing off SIs. We've seen that for a while now through SI committee, that in particular the hospital trust has been behind on that. We understand some of the reasons for that, but I think it is really hopefully time now to reduce the number of outstanding reports. The scale of outstanding reports is included in Sue's report. And the second area that we discussed really, and Jason might want to comment on this as well, was we just really compared and contrasted the way in which our different providers handled and managed SIs and handled and managed their attendance at the SI committee as well. So those were just two areas to focus on for the future for the SI committee.
Thank you, John. Does someone else want to speak? No?
I would just say that those have been fed back. The Deputy Chief Nurse attended Aqua yesterday and has fed those areas for development back into the wider team.
Okay, thank you. Okay, any other questions for Sue on that paper? Otherwise, we'll move on to the safeguarding annual report.
There's the CCG safeguarding annual report it's attached there at 11A. It's an overview of all the key issues, the safeguarding activity across the CCG, together with the work with our partners and stakeholders across the Safeguarding Children Partnership and the Safeguarding Adult Board. This report also went to Aqua yesterday, so I'm not sure if John's got some feedback on this. It does take account of our of other stakeholders' annual reports, though we've seen they're not included. Some of those are still in draft form, and work undertaken over the last year with also priorities for the coming year. And any areas that we feel that we should be concentrating on. So happy to take questions on that. It's got a rather stunning picture of the chief nurse and the chief officer at the beginning.
Yeah, so John?
Yeah, Chairman, again, this annual report was on the Aqua Committee yesterday, and again we were very supportive of the annual report. I mean, I think from our point of view, I think the report highlights the progress and improvements we've seen regarding our safeguarding arrangements within the CCG across Rotherham over the last few years, and also sets out, the agenda for the future to continue that. So we're hoping to see, further progress in terms of our safeguarding arrangements as well through that planning process. So yeah, so that was the feedback from Aqua.
Okay, thanks. Any other questions on that safeguarding report? No. So the governing bodies requested that we note, obviously, the receipt of the annual update, the objectives for 2020-21, and then we agree publication of the report on the internet and intranet site and share with our partner agencies. So I'm happy with that. Thumbs up where possible.
Thank you.
Okay, that's great. Thank you for that one, Sue. Patient and public engagement experience report.
Okay, an overview, thank you, Chair, an overview of some of the things that we're hearing and some of the challenges in terms of normal routes of communicating with people and groups not being available to us. and the work ongoing is a testament to the ingenuity and the persistence of Helen Wyatt, who's our lead officer for patient and public engagement. So some of the things that we're hearing about that are coming through, some of which are related to the impact of COVID, and some less obviously related to that. Some concerns about vaccines, flu vaccinations, and the amount of vaccine, and a little bit of information about the friends and family test there. Some of the work undertaken by Helen during this last month. I would say we have a meeting of the Patient Participation Group Network coming up next week, isn't it? It was on the action log, and we have actively canvassed for questions via the leads from all the practices that attend that meeting to come back to us with questions from their wider patient groups within their practices. That's been shared with Debbie and myself and Dr. Page, and there's quite a wide range of questions there that we know that are coming. It will be an open session, an interactive session as well, so we're able to prepare in terms of some of the concerns that people have wanted to raise about how GP practices are working, whether referrals are being undertaken. Can't off the top of my head remember many more. Dr. Page, I'm not sure if you wanted to add to that.
Yeah, I got sent the list of questions through this morning. They've been beautifully answered on my behalf, some of them anyway. or certainly the official answers, and I'll add my own personal thoughts to those. Yeah. I mean, to be fair, there wasn't anything unexpected. It'll be an interesting thing, and I'm quite looking forward to some curveball questions.
Yeah, I think what we've tried to do is to make sure that the questions that people had a chance to think through have come forward, haven't they? And that for us to be able to think through the answers and be clear, because I think I'd just like to endorse what Sue said really, is that, you know, this is a complex situation with COVID and post-COVID, and it's very fast changing all the time, and it's very difficult for our users and patients to be able to get their voice heard sometimes, and this is an opportunity we feel for them to ask the question, to listen to the answers. And we're also going to go at the end of the session, we're hoping to get not just questions and answers, but just to hear experiences that people may want to share with us in that meeting. So I think it'll be really positive. And as far as I'm aware, across South Yorkshire at the moment, we're probably the first ones to dip our toe in the water like this, to have an open meeting. Certainly others have been seeking out what we've been up to, and we've been sharing with them what we're trying and what works, and hopefully they'll do the same.
Thank you, Debbie. I think from looking at across a lot of the questions that have been submitted, I think that it's going to be really helpful having a GP in that meeting, because I think it's really clear that a lot of people want to hear the opinions of our GPs.
And I think, as it says in your report, so that one of the things going forward for us as the CCG is making sure we find every opportunity to hear the voices of the patients, and get this communication so it's clear and timely, so we can try and stop the confusion around the complex situation that we find ourselves in. We've got to be as agile in response in terms of supporting patients as we do in our communication, and listening to the voices to help us going forward.
Okay, thank you, Sue and Debbie. Any questions? Okay, we'll move on then. Next item is the corporate assurance report. I think Ian's going to take this because.
Okay, Jean, do you want to go? And I've just got some suggestions about next steps. So do you want to just do the report and then I'll come in?
Yeah, of course. Thanks, Chris. And this is just on behalf of Ruth, who's given her apologies today, Chair. So just in terms of the content of this report, just to remind colleagues, it's a statutory responsibility for us to produce the assurance report on a quarterly basis. So this covers the period April to June. A lot of the content is covered as a result of the response to the COVID pandemic. So in terms of the kind of key sections around national incident, and Chris also mentioned risk management and reintroduction of our GBAF and risk framework shortly. So we'll probably touch base on that in a second. We've had no external assessments during this period. In terms of the corporate governance side of things, pretty quiet on the whole, but we've reflected there the view in terms of complaints through the organisation and the continued work around equality and diversity and health and safety. For assurance to governing body, our work of information governance has absolutely continued through the whole of the Q1 period, through that pandemic period. And you can actually see how busy that part of the organisation's been in terms of ensuring that we have safe information and sharing safe information around the system linked to the COVID pandemic in the main. And then around the organisational development and staffing and governance, pretty static on the whole. And I know Chris mentioned the update to the OD plan earlier in the agenda, Chair. So that just gives the highlights. Again, we can open it up for a dialogue or feedback.
Thanks, Ian. So what I was going to suggest was pretty much in line with the OD plan. When we've reviewed particularly the risk register and the assurance framework, when you look at it in our post-COVID eyes, it just looks as if we need to have a completely different approach to managing this. So what I'm going to propose is that the executive take away the action and bring back probably a bit of November governing body, not quite a rewrite, but a completely reviewed risk and assurance framework. We can take it to ACWA as well, John, for comment and feedback. But I don't know if you'd agree, John, but I think it just probably needs just a major piece of work to fundamentally review the document.
Yeah, I think that's right, Chris. I mean, we did have this paper at ACWA yesterday, and we did have a brief discussion about the GBAF and the reintroduction of the GBAF. And one of the reasons we're supportive of your proposal earlier in your Chief Officer's report about reintroducing the full governance arrangements was that would trigger the use of the GBAF and the risk register again. But it is about 8 months since we last really looked at that, and things the world has changed very much. So I think you're dead right in terms of the proposal that you're making there. Yeah.
Thank you, Chair. So just for the notes, Chair, if we could take an action, probably be November governing body, if we can bring a fully reviewed, it'll be governing body assurance framework and risk register, and a proposal for a process to redevelop the organisational development plan.
Okay, any comments? Okay, we'll take that. We'll look forward to seeing all those in November then, Chris. Okay, moving then on to Wendy, just an update on the fraud, bribery and corruption policy.
Thanks, Chair. So apologies to everyone. This was my slip up last month where we managed to separate the actual policy from the header. So I think you just got the header sheet. So just to summarise, this policy, it was subject to a standard review. There were just 2 changes made to it. One at section 2, which expanded the scope of who would be in scope of this policy. So it just expanded the wording there to describe a few more types of roles that would be in scope of this policy. And then under 3.9, fraud champion, just to include a brand new paragraph into the policy to describe the role of the fraud champion. So they're the only 2 changes to draw your attention to.
Right, okay, and and then you said this last time, John, but ACWA are happy with this policy and the changes.
Yes, Chairman. I mean, I think the small number of changes, and the changes were supported by the fraud manager, and I think we have got a fraud champion as well. We have appointed a fraud champion.
Okay. So we're asked to note the amendments and support the proposed changes to the policy. We're happy to do that.
Thank you.
Majority of thumbs up. Oh, and Simon sent me a heart. That's the one up. He loves the policy. We'll have to get him involved next year.
Can be the next fraud champion.
Oh dear.
Okay.
Thank you.
That's great. Okay. Thank you. We'll just move through then minutes from other meeting. Members committee first, Jeff.
Yeah, I think just July's, just for note, or autism, I think has been here, there's section 75 payments, which has been here before, and just discussions about hospital communications, just as far as COVID issues. Don't know if anyone's got any questions.
Any questions for Jeff? Okay.
Thank you.
Primary Care Committee, Janet?
Thanks, Chair. They're just the minutes from the July meeting. They're the ratified minutes for information. I'm happy to take any questions. If anyone has them, the Primary Care Committee met again in August. And just to highlight three points from that meeting, which will come back in the minutes next time, there was a discussion about interpreter services and just some further work that the committee asked about looking about that. There was a discussion around the second phase of general practice response to COVID-19 and also an update on the STP Wave 4A capital programs and the Rotherham projects in that. There was other things, but they're the three items that I want to pick out, and happy to take any questions again.
Okay, questions for Janet? Okay, thank you, Janet. And then there's the Health Executive Group, Chris, minutes.
There's nothing I was going to flag up, Chair, unless anyone wants to ask any questions.
Okay, Chris. Okay, no one's brought up any other business for me to mention. Have we raised any urgent issues, or do we need to escalate anything? No. Everything we've raised, any risks? Therefore, we need to consider the following resolution: that representatives of the press and other members of the public be excluded from the remainder of this meeting due to the confidential nature of the visit to be transacted, which we all think. So from a public meeting, we'll see each other next month. Again, thank you for anyone who's joined us watching us on YouTube. Feedback about anything on this and questions from the public will always be gratefully received. Otherwise, the confidential meeting will commence at 2 o'clock, and we'll see you in a few minutes. Okay, thank you.
Yeah.
Thank you.